Welcome to this explainer. Look, as gynecology PG students, you guys are already incredibly familiar with the clinical hurdles of pelvic organ prolapse repair. Well, today we're unpacking a really pivotal non-human primate study that finally sheds light on the actual cellular mechanics behind mesh complications. So let's just ground ourselves right off the bat in the clinical reality you're facing on the wards every single day. A 5 to 20% vaginal exposure rate for vaginally implanted meshes. I mean, that's a massive chunk of your patients coming right back into the clinic, dealing with pain, infection, or exposed synthetic material. We all know the FDA warnings, right? And obviously, we know the clinical presentation of exposure and erosion. But as surgeons in training, really as the future of urogynecology, we've got to stop and ask the deeper mechanistic question here. Why exactly is this tissue failing? Like, what is actually happening on a microscopic level when we slap these synthetic supports right up against the vaginal wall? Well, this seminal study basically hands us the punchline right up front. Look at what the researchers concluded. Mesh implantation with the stiffer mesh Gynemesh PS induced a maladaptive remodeling response consistent with vaginal degeneration. So they're literally pointing the finger directly at mesh stiffness as the main culprit behind all this degenerative tissue response. Here's how we're going to break this all down today. First, the pot mesh complication mystery. Then, modeling mesh stiffness in primates. Next, histology, visualizing vaginal degeneration. After that, the biochemical breakdown. And finally, stress shielding and surgical implications. Okay, jumping into section 1, the pop mesh complication mystery. You know, synthetic meshes were heavily adopted to tackle the frustratingly high failure rates of native tissue repairs. And yeah, while they definitely provide excellent mechanical support for compromised tissues, the reality is that the original prototype meshes were incredibly stiff. And this really sparked the core hypothesis for the researchers, that maybe it isn't just the presence of a foreign body causing issues, but the stiffness itself that's driving the complication rate and causing tissue degeneration. Moving on to section 2. Modeling mesh stiffness in primates. To figure this out, they used an absolutely fantastic translational model, 50 Paris rhesus macaques, which honestly is a perfectly chosen proxy because their pelvic floor anatomy so closely mirrors human biomechanics. These were multi-Paris animals with minimal prolapse, meaning the team could observe the undisturbed baseline tissue response to the mesh. So post-hysterectomy, they performed a gold standard sacrocolpopexy and then harvested the mesh vagina complex after a 12-week implantation period. They basically pitted the highly stiff prototype Gynemesh PS against newer generation lower stiffness meshes like Ultra Pro and Smart Mesh alongside a sham surgery control group. And you can see the clear difference between our contenders right here. Look at that high stiffness prototype, Gynemesh PS. It's boasting a massive ball burst stiffness of 27.5 newtons per millimeter. Now, contrast that with the newer generation, lower stiffness materials like Smart Mesh, which sits way down at just 11.1. So the stage is totally set, right? It's high stiffness versus low stiffness. Let's look at the actual tissue in section 3, histology, visualizing vaginal degeneration. Just looking at the gross morphology of the harvested tissue complexes. I mean, you don't even need a microscope for this. Right there in the middle, you can easily see the stiff Gynemesh PS bulging and rigid right through the abdominal tissue. It's super pronounced. But then, check out the lower stiffness Smart Mesh. It's beautifully integrated, flat, and honestly, barely even visible. And taking a closer look, this brilliantly illustrates the microscopic damage. On the left, Masson's trichrome staining shows severe muscularis disruption with the Gynemesh. Those normally organized muscle bundles are just totally decimated. Meanwhile, on the right, the immunofluorescence highlights a huge spike in green apoptotic cells, which of course means active cell death, specifically clustering right around the stiff mesh fibers of the Gynemesh group compared to the lower stiffness options. The structural integrity was literally being destroyed by the stiff mesh. When they actually quantified it, Gynemesh PS caused severe thinning of the smooth muscle layer, dropping it down to just 866 micrometers. Put that next to a robust 1,557 micrometers in the sham control group. It basically slashed the thickness of that vital smooth muscle layer in half. Which brings us to section 4, the biochemical breakdown. So at the cellular level, the extracellular matrix essentially falls apart under the influence of that high stiffness. We see a really stark 43% plummet in mature elastin and a 20% drop in total collagen in the Gynemesh PS group compared to the sham.
And this is devastating because it completely robs the vagina of the exact structural proteins it desperately needs to maintain support and elasticity.
But it gets worse. It wasn't just a failure to produce new matrix proteins. Total collagenase activity, the actual enzymes responsible for breaking down collagen, spiked by a massive 135% in the Gynamish PS group. So the tissue framework isn't just failing to rebuild itself, it's actively and aggressively chewing itself up.
And this degradation was paired with a significant spike in sulfated glycosaminoglycans, or GAGs. Now, in this specific physiological context, elevated GAG levels are actually a primary marker of acute tissue injury. So this pretty much proves that the stiff mesh induces a state of continuous acute injury and maladaptive remodeling long after the initial surgery is over.
All of this leads us to Section 5, stress shielding and surgical implications. Okay, so the core biomechanical phenomenon driving all of this chaos is called stress shielding. In biomechanics, this happens when a stiffer implanted device absorbs all the mechanical load, which ends up buffering the adjacent tissue from experiencing its normal physiological forces. Because that underlying vaginal tissue is suddenly deprived of the everyday stretch and tension it fundamentally needs to survive and remodel, it leads directly to atrophy and degeneration. Let's trace how this builds into an absolute perfect storm for your patients. First, the stiff mesh absorbs the physiological loads of the pelvis. Second, the underlying vagina is quote-unquote shielded from normal stretch. Third, the sudden lack of mechanical stimulation literally signals the cells to trigger collagenase. Fourth, the existing extracellular matrix proteins, like your collagen and elastin, rapidly degrade. And the ultimate result? Profound vaginal wall thinning and a drastically increased risk of mesh exposure. But hey, the really good news for your future patients is that the newer, lower stiffness meshes evaluated in this study, like Ultra Pro and Smart Mesh, largely mitigated this entire effect. Because they actually allowed the tissue to stretch alongside the mesh, they preserved baseline smooth muscle thickness and totally avoided those massive, tissue-destroying spikes in collagenase activity. So, as you finish up your PG training and step into the OR to perform a sacrocolpopexy, ask yourself how this profound basic science reality is going to influence your surgical technique. The stiffness of the mesh you're holding in your hands literally dictates the cellular survival of your patient's vaginal tissue. Are you going to choose a material that shields and degrades, or one that actually integrates and supports? Thank you so much for joining me for this explainer, and keep asking the deep questions.